show you the pancreas in the body and tail. So you can see the pancreatic duct just below the probe with the splenic artery and vein. And as I go clockwise towards the body tail area, this is the area of abnormality that's been shown on imaging before too, over years. And this is where the patient has had a cyst gastrostomy as well. So we saw this area of irregularity in the parenchyma slash duct, and I had Dr. Hassan come into the room as well, and we looked at it. It's not super convincing for a mass, so we debated between sampling or not. And the other thing is the upstream duct, which is there, is not dilated. So we think this is the area where she just had prior duct injury. So we decided not to sample this area. So instead we just basically will just perform the celiac block, and we're going to stent the pancreatic duct because she does have increasing pain. So if there's a component of obstruction, especially in this area, then we can just put a stent in and see if that gives her some relief.
Mustafa, Saad bhai keh rahe hain ki there was a recent MRCP. Did you get to see that or no?
I think when he showed me the report, I have not seen the images though.
Okay. Report anything new or pretty much same?
Saad bhai may have it. I think it just mentioned this cystic collection in this area.
So the point is, like, if this patient did not had a cyst gastrostomy before, and she did, so she did not had a, if she did not have that, and the distal pancreas, there were more convincing changes like dilated duct or atrophy or changes of chronic pancreatitis, which are more as compared to the head of the pancreas, then this area would be concerned. So right now it would be easy to stick a needle there, but why to put a patient at risk, which is going to be a very low yield for any major abnormality. We know there's probably a disconnection there, disconnection or disruption of the duct in that area.
Yeah.
And all that, that's a fluid there. There's a little bit that debris looking area. That's not a mural nodule, I don't think so. It looks more like probably a little bit necrotic area. So
and I think one thing, and you can see the duct, it just dilates up slightly here. I think the question will be if there is relief, if we get across with the wire and put a stent in, whether or not she would benefit from, and she gets relief, would she benefit from a distal or not? That's been discussed with her over the years. And the patient has been reluctant to undergo surgery.
I think, yeah, hopefully wire can get across and see how she does. But if it doesn't, then I think we're getting...
Then I think close follow-up would be important, just to make sure we're not fooling ourselves into thinking that it's something benign.
Yep.
And then consider sampling.
Exactly. That is very important. Like, we need a close follow-up. अगर कोई change हो imaging के ऊपर, तो then we need to do FMA of that.
So we're just going to switch to ERCP.
That's what we're going to do. So that's what we're saying. If we can get a wire across that area into the distal duct, then we're going to put a stent in.